Hello and welcome to another episode of GOA365's Face to Face. I am Glenn Costa, and today we are here to discuss, that's what's happening around the world and in India and in Goa in the medical field. With me is Dr. Ajeya Mundhekar. He's a cardiologist. Doctor, welcome to our show.
Thank you.
Somebody who I hold in high regard for lots of reasons, including personal. So we have been this thing again. We thought we would take it up. Doctor has been here in the studio about 3 years back, but we took it because of this Zariwala issue. She got a heart attack, and then we have so many young people, dying at 40s, 50s. Supposedly they gym, they have, but then they're having these cardio issues for whatever reasons. So I thought we would take this up with doctor to find out why, and maybe he could give us some advice so that the youth or the people who are actually running the country and this can take care of themselves better. Because one thing, doctor, whether we like it or not, stress is a part of our life, depending on what type of job, business or profession like yours you do. Yes, doctor, so what is the scene? You were, that day when we were talking, you were saying it's not as bad as COVID time. What is it generally? Give us a general overview first.
Yes, like coming to the stress point of view, definitely stress is definitely a part of our lives, and somehow we Indians we believe that working hard or working excessively beyond our the standard working hours has seeped into our culture. So that is somewhere we need to limit ourselves. We should not strain our bodies so much that at some point they give up. Coming to the part of how it is the age profile of the cardiac patients, what I see in my practice is gradually the age profile is again shifting back to the pre-COVID times. Okay. During COVID, we did see increased in incidence of young people having heart attacks, sometimes strokes, lot of clot formation, pulmonary embolism. All these things we did see significantly, and it had risen up quite a bit during COVID times. No denying the fact. We all know that the vaccines also had their pros and cons. But now gradually my patient profile, or what I would say is those people who have really tight blockages and disease, that has gradually again moved back to 60 plus. Most of them are 60, 70 okay. and of this age group.
Which is like normal.
Which is normal, and which has gone back to the pre-COVID times.
When you say tight blockages, means like 90% plus, you're talking about that?
Usually we talk about when we grade the blockages, we grade them as mild, moderate or severe. Okay. We are talking about blockages in the blood vessels supplying the heart, that is coronary arteries. Okay. When they the blockage thing starts from a very early age. It can start just like a fatty plaque. It can start even in early childhood. Then gradually over a period of time, it takes a lifelong or a long period, decades to build up. Unhealthy lifestyle, junk food, blood pressure, diabetes, kidney problems, genetics, lack of exercise, obesity, all of these factors contribute to these blockages growing. So what happens is the blood vessels accumulate the cholesterol. The cholesterol then accumulates macrophages and dead cells with then calcification. So with age we see these kind of blockages. But of course so many times like we see surprises as well, but not exactly surprises. Those people who have maintained a very fit and healthy lifestyle, sometimes they come for an angiography for some other purpose, but then their fit lifestyle reflects and their angiographies are completely normal. So
I see, even angiographies are normal.
I've seen that even at 75 and 80 years of age.
I see.
But so lifestyle and all these factors definitely do matter, and I can't stress more the importance of a healthy lifestyle.
What do you mean by healthy lifestyle?
By healthy lifestyle, what I mean is at least 30 minutes of aerobic or cardio type of exercise every day.
Every day?
Every day.
You can't take a break?
Ideally not. But minimum, okay. At least we should try for 5 days a week.
Okay.
So maybe one or 2 days we can leave the weekend, but at least 5 days a week, 30 minutes of cardio type of exercise. It can be running, cycling, brisk walking, swimming, badminton, tennis, all the cardio, treadmill, all these cardio type of exercises that we talk about. Of course, somebody wants to do more and do some weights and all, that is perfectly fine provided your heart is healthy. But at least 30 minutes of cardio exercise is important. And now, so coming to the point of why we see this disease in young adults is what has happened probably post-COVID, and not simply post-COVID, it would be a phenomenon over, I would say, last decade or a decade and a half. Is people have suddenly gotten into, I want to get into fitness. They don't go back and look, were you fit all throughout your life?
No.
Did you participate in sports right from your childhood? No. We are all the way behind our academics, studying, behind our jobs, behind our businesses, and then suddenly at 40 I realized, no, okay, now I'm 40 and I'll start running. That is when the problems start, because your body is just not accustomed to it. So you need to give your body time to get accustomed to that exercise. Also, before getting into any strenuous exercise regime, it is always advisable to get yourself checked, get your sugars checked, get your cholesterols checked, probably get a stress test, ECG stress test and a standard cardiac checkup done to make sure that you do not have any pre-existing problems. That would kind of preempt the risk of having a heart attack. That is an important thing. And so many times it is not simply blaming the patient, so many times it is the inertia from the doctors as well. We don't push the patients enough to achieve their targets, to achieve good sugar control levels, to achieve good cholesterol control levels, to achieve good blood pressure. Thoda bahut chalta hai, that attitude is also seen from the doctor community as well.
Because in India, I guess it's like, but I don't know, there is some propensity for obesity also among Indians, cardio disease also. Why is that? Because of our food, what? Or because generally, or stress? Because I don't know, you sleep on the bed, you like put up, you say, but is it some predisposition, genetic? What is it?
The predisposition definitely is there.
Is there?
We as South Asian population are predisposed to, we are the diabetes capital of the world. Our cholesterol levels are much higher as compared to our Western counterparts.
Why?
One thing is, it is in our genetics. Now, coming back to the question of why is it in our genetics, it is a difficult question to answer, but a reason behind that could be our diet. Our diet is very much carbohydrate centric. We like to eat a lot of carbohydrates. With every meal, we have to have chapatis, rotis, pav, poi, rice. We have to have our carbs, and rest of the thing becomes supplementary. Whereas if you look at what the Western diet is on a day-to-day basis, don't look at what they eat on the weekends, or don't look at that big burgers in US, but in general, if you look at what Europeans eat, their diet is predominantly protein concentrated. They don't concentrate so much on the breads. So, and this has been going on since generations over generations. Maybe because we were such a fertile land which grew all these grains, and we were enriched with this, whereas Europe, you know, with the snow and all that, they didn't have all these things. They had to kill animals and eat. So
okay. Yeah, just we'll go in for a small break. Keep watching. Welcome back. Doctor, we were talking just before the break, we were talking about the type of diet, the European diet, American diet, and why is this that we are so, we have a different type of a thing, and the Europeans and all.
Yes. So probably I feel diet as well as exercise contributes in it. Like we were saying, our diet is so much carbohydrate centric, and what happens with carbohydrates is excess carbohydrates get converted into fats, and these fats then go ahead and get deposited in the blood vessels, lead to blockages, increasing the risks of heart attack, stroke, or any other multiple problems. Also, excess cholesterol increases the risk of diabetes. It's all a part of a whole thing called as metabolic syndrome. All of these things, diabetes, blood pressure, heart attack, stroke, are kind of interrelated when we talk about the metabolic syndrome. Whereas when we look at the European diet, it is more of protein centric. Their lunch will be so small that you'll feel, is this really a lunch? But it will be mostly concentrated in proteins. It might be some chicken fillet, some fish fillet, but it is protein rich diet. Second is when we talk about the environment, they have a very conducive environment when it comes to long walks, runs, jogs, or going up trekking up the hills. we really can't think of doing that when we are talking about our Goan summers or Indian summer. We don't want to be
rains also
even rains. So 1/3 of the year is gone in rains, 1/3 of the year is gone in summers.
Correct.
So we have very little time when we can do outdoor activities. So that limits our outdoor activities. But that is why it is important that whatever possible for us, if it is early morning, late evening, when the weather is conducive, or if not outdoor, at least indoor, as in like in a gym or a treadmill at home. But we should somehow find out ways for ourselves. Or probably even I tend to tell my patients many times, swimming is an excellent exercise. So even if it is summer, very hot outside, you would love to have a cool dip. So concentrate on swimming. So these are the exercises we should be focusing on. Also, we should be trying to focus on decreasing the carbohydrate content of our food. And each of our regions, different regions of India are famous for their different sweets, and all of us love our sweets. At the end of our meal, we want a sweet. So that is a habit I ask my patients to curtail on.
That is another habit which you need to, like, see, for example, suppose if you are diabetic, it's not advisable to eat too much of rice or wheat or whatever, but you need to have protein. Now suppose if you have cardio disease again, but how do you, now if you already have these, how do you sort of manage these through diet and through exercise? How do you, means what do you have to do, like generally for the common person? Yeah.
So there again comes like different diseases come with different dietary restrictions. Like for example, patients with high blood pressure, they should be eating as less sodium as possible.
Okay.
Now we need to focus which foods contain sodium. So definitely it has to increase, our food has to have less salt. It has to have, we should not be eating pickles or processed food which are rich in salt. Soda, we should avoid soda in our diet, and try to increase nuts, legumes or green vegetables, salads, fresh fruits. These are the diets we should kind of focus on, or what we call as lean meat, that is fish and chicken.
White meat.
White meat. Red meat is bad across almost most of the spectrum, be it high blood pressure, be it diabetes, be it cholesterol, or be it heart patients. So we generally ask our patients to avoid red meat. Lean meat is good, but then again, if we fry our lean meat, then we add the bad components to the good food.
Yeah. So like the most of India fries its food. So how do you eat the meats? Boiled?
Boiled or curry. Meat in curry is quite okay, or Indian preparations with as less oil as possible. Or even if you love to fry your food, air fryer is definitely a good option. You really don't have to add oil, and it's just
or you have to add very less oil.
Very less oil.
Even if you have to use oils, what type of oils you need to? Normally you use like sunflower oil or whatever. Which oils are better? Peanut is not good, not good.
Yeah, usually groundnut oil and is not good from a cardiac patient's point of view. Coconut oil has kind of mixed reviews. There is some literature which supports use of coconut oil, some literature which opposes it. So when it is in the grey zone, I ask my patients to avoid it. Sunflower, safflower, rice bran oil, extra virgin olive oil, these are usually good and relatively safe oils from the heart point of view. But even those in as less amount as possible.
Exercise. So for example, now you can't go out, so assume you cannot go out brisk walking and all that. So what type of exercise like would you recommend? You buy your own cycle, I mean those stationary cycles?
Yes, stationary cycles, or there's sometimes we have patients who are limited by their arthritis. They have joint pains and arthritis, and they really can't even do a cycle. Swimming is an excellent exercise. Sometimes just if you can't swim, wading through shallow water, you can just go at the against resistance. Yeah. So you can be at the shallow end of the pool and just wade through it. Okay. That also is a good exercise. If you can swim, that is excellent. If you can't go out, stationary cycle or treadmill test, they are good. Even indoor badminton courts. Badminton is an excellent exercise. So all these exercises, if there is a will, definitely we can find a way.
Absolutely. But even then, now we were just talking about this in the beginning when we were talking about this Zariwala case. Now this girl is supposed to be very fit and very. So what are these very fit gym going people who are like they suddenly collapsing? Now we see so many videos. One guy was in the gym, duck there only. So what is this thing? And especially now, see, Indians have always forget, I don't think, but mostly people from looks and all are important. Like you have this, especially if, depending on what type of profession you need, your aging, anti-aging, you so many different types of treatment. You just open your phone and like, so what is this bad? Is this good? What is it according to you?
I would divide this question in two parts probably.
Okay.
One would be what happened to, unfortunately, what happened to Shefali Zariwala, and second is people suddenly dying, or that would be, I would call it as sudden cardiac death. So probably what happened in Zariwala's case was it was found that there were a lot of supplements which were found at her home, including glutathione and minerals and a lot of things. Now what happens is, any of these things taken in excess, which is not recommended, can be extremely toxic. If glutathione is taken in excess, it can affect your liver, kidneys, lungs. There are a lot of things it can affect.
But not heart.
It doesn't have a direct relation on the heart, but all these organs are interrelated. So maybe one thing leads to other thing leads to, and finally, the way a person dies is when the heart stops beating.
Yeah, correct. Fair enough, absolutely. Yeah.
So we don't exactly know what happened to her. Probably as reports come in, we'll be in a better position to what happened to her. But coming to the supplements part, this supplements part, if at all anybody has to be on supplements, they have to be taken in consultation with the correct doctor or correct professional. If you just today, if you open YouTube or Instagram or Facebook, you'll see things being promoted, things being promoted right, left, and center, because there is no regulation. But anything which comes has to come through a scientific society. Like for example, even we introduce any new medicine into or we prescribe any medicine to a patient. When this new medicine is introduced in the market, that has gone through extensive research. And it is clearly told that this medicine can be had in these conditions, cannot be had in these conditions. There has to be caution when prescribed with another medication. Here what is happening is probably we are on some other medications and we are taking something which otherwise might be helpful. But how those two things will interact, we never know. So taking multiple supplements, they might have interacted with each other, causing some toxic reaction. Probably it could have led to an arrhythmia or irregular heartbeat that could have caused a sudden cardiac death. Coming to the patients, like coming to young people who sometimes suddenly drop dead.
Young, middle age, whatever. Yeah.
So that is what we call as sudden cardiac death. Many times in sudden cardiac death, blockage doesn't have to be the reason. Blockage is just one part of the spectrum of heart diseases.
I see. Okay.
There are different types of heart diseases. One is called as arrhythmia. What is arrhythmia? Arrhythmia is a irregular heartbeat. It can be a slow heartbeat, which is more commonly seen in the elderly age group, or a sudden fast heartbeat. So it is so many times an inherited condition. But a fast heartbeat can many times be also after recreational drug use, smoking,
any adrenaline based.
Any adrenaline based. Okay. Any supplements causing sudden fast heartbeat, that can also lead to sudden cardiac death. There are certain medical conditions which are predisposed. There are diseases of the heart muscle which can lead to reduced pumping of the heart, called as cardiomyopathy, or there are diseases of the heart muscle which lead to weakening of a particular part of the heart, which then leads to a focus of irregular heartbeat, and that can lead to sudden fast heartbeat and stopping of the heart. When we talk about heart diseases, it can be diseases related to the blood vessel or vasculature, which we are commonly afraid of, and we talk about as heart attack or blockages, which are then treated by medicines, angioplasties, bypass. The second type of heart diseases are diseases of the muscle. We call them as cardiomyopathies. The third diseases are diseases of the heart rhythm, which we talk about as arrhythmias, the slow or the fast heartbeats. These are the common types of heart diseases. And diseases which are systemic diseases but affect the heart are high cholesterol levels, diabetes, high blood pressure. They indirectly affect the heart, because if the blood pressure is high, the heart has to pump against that much of blood pressure. That leads to thickening of the heart muscle. So when the heart muscle becomes thick and large, the blood vessel remains the same. So that same blood vessel is not sufficient to supply blood to rest of such a big heart muscle, increasing the risk of a heart attack. Heart attacks or heart problems are even common in chronic kidney disease patients. Patients on dialysis so many times have heart problems. So as such, lot of other systems also affect the heart.
I see. So now what do you do? Basically exercise is there something, or
and
diet?
Exercise, diet, both, and medications. Medications wherever necessary. So medications should be usually be the last resort. We give medications when things, diet and exercise are not able to control the things.
Not enough to control.
Not enough to control the things.
Okay.
Whenever a patient is diagnosed with diabetes, blood pressure or high cholesterol levels, initially for the first month, 2 months, even up to 6 months, we try to give them a trial of a healthy lifestyle or lifestyle modifications we call them. So change your lifestyle, get into regular exercise regime, change what you eat. Change your sleeping hours, have regular at least 7 to 8 hours of sleep, be well rested, practice some meditation, exercise regularly. Then try to check your levels again after 3 months, 6 months. If the levels are still high, that is when we start medicines. We start medicines in the lower dose, and then depending on how much the patient needs, we gradually build up the medications. But medications should always be the last resort. Exercise and diet should be first.
Now the thing is, now see, now the, say for example in the profession you're in or I'm in, see, stress is normal. Our sleeping hours, we only don't know when. So what to do in those cases? Like so many of, like today, any upper management is like little, it goes out of hand. So what do you do in those cases?
I would talk from my personal experience rather than from a patient's
because
purview. From
typical so as to say.
My personal experience, I have always seen that when I'm into a regular exercise regime, or I'm in a much positive frame of mind, I'm able to handle much more stress. Even stressful situations won't stress me that much. Meditation helps a lot. So meditation and exercise, if you somehow find time for that on a day-to-day basis, probably they will help you to cope up with stress much better. Stress is unavoidable, but it's our frame of mind, how relaxed we are and how we tackle with stress.
Also diet.
Also diet, exactly. See, for example, there might be situations when people are stressed and they just want to go out and have a smoke, but that is not the right way to tackle stress. Smoking eventually is going to get back at you. Or people just to feel relieved from stress, you go out for binge drinking. That is not really going to help you.
Or you end up doing some, just like overnighters.
Absolutely, absolutely.
Now you say 7 to 8 hours of sleep, right? So 7 to 8 hours, sometimes you sleep late, second shift and all. So it should be 7 to 8 hours from the time it can be whenever, but you have to sleep for so many hours continuously. That's what you're trying to say, right?
Preferably if you can have a regular time, that's the best thing.
That's the best
but many times it is not possible.
Even regular time, even if it's a little late, early, it does not. It has to be 7 hours.
Yes.
It has to be exercise. You got to hold your diet. So these are the things that basically are non-negotiable. That's what you're trying to say.
Non-negotiable.
Whether you're on medicines or you're not on medicines.
Yes. And what we really need to understand is why are we doing that? Probably all the stress that we are taking, all the hard work that we are doing are probably going to earn us more money. We are going to have a more posh lifestyle. But if we don't have the body to enjoy that life,
what is the point?
What's the point?
And then I don't know, but I think after a certain period of time, it's not. See now, like if you have initially when you're new, you don't have the money and you don't have the time. So later on, you have the money but you don't have the time. Then you don't have the time and you have the time and you have the money, but you're still doing it. It becomes, what is it, a habit forming?
It becomes a habit because it's like it is like that addiction. That is what drives you, and if you don't do that, there are so many examples even in doctors, like even at the age of 75, 80, they will continue and
full-fledged.
But one good thing is they have maintained good health so as to continue at 75, 80. But there are so many doctors that you see, even among doctor community, so many times you see that people die young. Doctors probably have the reduced lifespan by almost 10 years as compared to the general population because of the strain.
But general population doesn't go through what these higher level of, whatever the stress type of populations are there. Maximum general population, almost 80-90% is like, okay fine, I get a salary, I have to ensure that the salary lasts up till the end of the month. But here when you are in the other, that becomes and even if, see, even if you are at that level and then you have X amount, X, Y, Z thing, you still manage it and still continue that, no? Otherwise, what is that mentally? Then you die if you don't do work. I don't know. What is the scene?
So that is where I feel
I think probably I'm talking about you and me also.
Very true, very true, very true. And that is
what do we do if we
I personally feel like that way we Goans are blessed to have a relatively satisfied mindset.
Correct.
We are not so much we don't want so much to be in a rat race. We want to get home in time, have our food in time, relax a little bit. But eventually what rest of India is going through or rest of the metros are going through will catch up with us.
It's already caught up.
It's already caught up.
Yeah.
But that is where we need to make a choice for ourselves. And we need to consciously make a choice for ourselves. It's not something that we can indefinitely postpone. No, nothing is going to happen to me. It's very easy to believe, okay, it happens to the others, it won't happen to me. It will.
Yeah. So, doctor, now basically what you are saying is that there is no negotiation. We need to do this, we need to do this, we need to do this. Even if you do this, many times you still go through, you suffer through thing. Even then you have to manage, but you cannot give this up and you try and like, that's what your final words of wisdom, so as to say.
Absolutely, absolutely. Because I'll give you some examples of my patients. Like they have had massive heart attacks, and when we talk about the damage to the heart, their hearts were severely damaged. The ejection fraction had gone down to almost like 15-20% as well. But with regular medicine, diet, exercise, I've seen them getting so fit. One is the heart pumping also recovers, and there are a few of my patients who are now even running marathons.
Really?
After such major heart attacks.
Okay.
I don't want to name any, but they are here and around living in Panjim.
Okay. So anyway, that is something good for us, and also it's not as scary, because many times on the media and all, when it comes, it scares everybody, and then you get calls. That's why I thought like, okay, I'll get Dr. Ajeya just to
Thank you so much.
Yeah.
Thank you for that opportunity.
Thanks a lot, doctor, and it is a pleasure to see you again. And
it's always a pleasure to see you, Glenn. Thank you.
Now, this is Dr. Ajeya, and this is something that this has been happening more and more often to people, because now I know doctor says that in Goa we are not, but today Goa is also a part of the global network, be it in whatever profession, the profession he is in, we are in. So this timing, long hours, I think it's become part of life. So we should learn to manage, take a break, that work and break sort of a thing in Goa also. Anyway, I am Glenn Costa on Face to Face for GOA365. Thank you very much. Keep watching.